Hi, my name is Dawn. I'm a psychiatric mental health nurse practitioner. If you saw my introductory video, you know I work in dual diagnosis addictions in an inpatient unit. I also do primary mental health in an inpatient unit and some outpatient care. I did a video on the 10-80-10, which was 10% in the past, learn from our mistakes, but we really have to get over ourselves. We really have to move forward because we're on this human journey and we all make mistakes. And sometimes we stay stuck in the past and we have depression. 10% in the future, we can plan for the future, but don't get emotionally attached to the fantasy you think the future is going to look like. Because then when things don't line up, we wind up dreaming a fantasy and not the reality of what we were actually living. 80% in the moment. And we talked about mindfulness, we talked about gratitude, you know, when we're grateful when we get in the shower in the morning, when we're grateful when we have our cup of coffee. When we spend our day in gratitude, then we don't fall into depression or anxiety because we're grateful for this moment and we're living in the moment. So then we talked about the baby fox story and how trauma affects the brain as it's developing. So we talked about fight, flight, freeze, or fawn. So now I want to talk about different ages of trauma. So we look at a trauma timeline, and when we think about different ages of trauma and how we react to life differently at different ages, a 3-year-old is going to react differently to trauma than a 5-year-old, or to even stressors than a 5-year-old, right? Than an 8-year-old, than a 12-year-old, than a 16-year-old, and so on. When I talk about trauma and PTSD, a lot of times patients will say, well, I didn't serve in the military, I don't have PTSD. Trauma can be perceived trauma. Trauma can be the trauma of losing a parent or losing, having a sick parent, or our parents being in a traumatic state or an anxious state, and therefore we feel unsafe as we're growing up. So trauma can look differently. We can also have secondary trauma where we're exposed to trauma that somebody else is going through, but we feel the emotions of those traumas. So if you think about it, when you have a different trauma at different ages, if we don't develop through that trauma in that age, then we'll get stuck emotionally in that age. So I shared in the previous video about losing my husband in 2013. Basically, when I lost him, I was a 3-year-old who could buy alcohol. I was throwing a temper tantrum with God. I was having this emotional reaction of abandonment. And because my first understanding of my trauma and my environment and the things that I was going through and those feelings of emotional abandonment was about 3 years old. So when I was triggered, then I was going back to an emotional state of a 3-year-old. So if you think about what each age of trauma can look like and how a 16-year-old will respond differently than a 12-year-old, than an 8-year-old, etc., when we're triggered and it reminds us of a different age of trauma, then we're going to act a little differently because emotionally we didn't develop past that stage. So it's going to look different, right? And when we have different diagnoses, so maybe we have major depressive disorder, generalized anxiety disorder, borderline personality disorder. Think about a 12-year-old girl in middle school, drama, drama, drama. 1 minute you're anxious and you're worried about a boyfriend breaking up with you, and the next minute you're happy because somebody else is happy, and you're feeding off of their emotions, and you get stuck in that drama. That's basically borderline personality disorder as an adult. I want to make a distinction for everybody between personality disorders and the diagnoses. And I like to use OCD versus OCPD. So somebody with OCD is anxious, ruminating, doing rituals. It's driving them crazy and it's driving the people around them crazy, and they want something different. They don't like how they feel. Somebody with OCPD, same scenario, but they feel like everybody else is the problem. They're not the problem. Everybody should think the way they do. So that's what our personality disorders, when we have a personality disorder, it's an exaggeration of personalities, but it's also everybody else is the problem. So we use DBT when we're working with borderline personality disorder, radical acceptance, and also how do we accept things the way they are and then look internally to ourselves to try and help through that healing process. But when we look at these ages of trauma and how we might respond differently, when I have somebody who's really going through something, I might ask them, check in with yourself. How old do you think you are right now? Emotionally, they can typically identify an age that they maybe are feeling. And sometimes when we're in an argument with a partner, we might be 5 years old emotionally and they might be 7 years old emotionally, because it's triggering these abandonment issues and these anxieties and that fight, flight, freeze, or fawn. So recognizing those things and saying, okay, yeah, you know, at 3 years old, I did lose my father, and maybe I did feel the sense of abandonment my mother was feeling. Even though she was an amazing mother, I still was feeling these things because she was afraid. It's nothing against our parents. It's more recognizing when we're exposed to different things. An anxious parent, we might feel anxious as a child and feel unsafe. So I just want, as part of this whole process, I just want to recognize when we have these ages of trauma, when we have PTSD, we can have a whole list of diagnoses, and I use those diagnoses as just kind of a guide to tell me how the patient's responding or reacting to their trauma. And then we start to unpack some of these things. So that's what kind of going from the baby fox story, fight, flight, freeze, or fawn, we have sort of that empath. We have feeling all these emotions. We have trying to place our home in other people and our identity in other people instead of in ourselves. And then we also have that ages of trauma where we might respond or react differently. I'll use the example of a grown man at the side of the road. He gets rear-ended. He jumps out and he's throwing an adult temper tantrum. It's a normal everyday event, but he's carrying this anger that really is founded in fear of not being seen, not being heard, of abandonment. And so he's constantly in this mode of just basically throwing an adult temper tantrum because he got stuck somewhere, right? And can't just deal with a normal life experience without going back to an age of trauma. So that's what I wanted to talk to you guys about. Next, we're going to talk about the ages of trauma, the developmental stages, Erik Erikson, the developmental stages, and we're going to get out the crystal healing bowls and we're going to talk about the chakras and kind of how to heal that, because this is a spiritual journey. So we use this as a tool to kind of help move us in a different direction, something a little different to add to our toolbox for healing. So thank you, and yeah, stick around on the journey. Thanks.